Picture this. In a village that used to be quiet because of malaria, you now see children lined up for a new vaccine. Could this finally signal the end of one of the world's deadliest diseases?
Yeah, and it's May 9th, 2025. We're actually living through something historic here. These malaria vaccines are reaching kids in 17 countries where malaria has been, well, devastating for generations. For the first time, the WHO has recommended the RTS S vaccine, and it's being delivered at a scale we haven't seen before. Why is that such a big deal right now?
The numbers really put it in perspective. Each year, over 600,000 people die from malaria. Most of them are children under 5, especially in sub-Saharan Africa. Since 2023, more than 12 million vaccine doses have gone out. That means about 5 million children now have some protection against malaria, a disease that's shaped entire communities. That scale, honestly, it's never happened before.
Let's drill down for a second. By early April, 19 countries had actually added malaria vaccines to their childhood immunization programs. That includes places like Ghana, Kenya, Nigeria, Uganda. For families there, this isn't just another shot. It could literally be the difference between life and death.
And getting here took years. This rollout is built on pilot programs in Ghana, Kenya, and Malawi from 2019 to 2023. Those pilots reached 2 million kids and, crucially, led to a 13% drop in child mortality. That's not just a number. It's thousands of kids who are alive because of this.
Wait, so those pilot programs, what really made them stand out? Was it about getting vaccines out even when COVID was, disrupting everything?
Yeah, that's a big part of it. They managed to keep the vaccine programs going right through the pandemic, which was huge. Plus, they worked within existing immunization systems. And here's something interesting. Did you see how the pilots reached kids who weren't even using bed nets?
Right. More than 2/3 of the kids who weren't sleeping under insecticide-treated nets still got vaccinated. That's a big shift, isn't it? So, vaccines aren't replacing bed nets. They're more like, another critical layer of protection.
Exactly. That's changed the whole strategy. Vaccines add to what's already there, not take away from it.
Looking ahead, 6 to 8 more countries are expected to join in this year. Uganda, for example, is about to introduce the malaria vaccine for children under 2, this month actually. The whole effort seems to be gathering steam.
Now, there are actually 2 vaccines in play. The RTS S vaccine from GSK was rolled out first. But since July 2024, the R21 vaccine from Oxford's Jenner Institute has joined the fight. Do you want to break down what sets them apart?
Sure. RTS S, sometimes you'll hear it called RTS S/AS01, needs 4 doses, which is, a bit of a logistical challenge, but it's been doable so far. R21, on the other hand, is part of a new wave of malaria vaccines. It targets the parasite at different stages, might need fewer doses, and could help meet demand in places where supply is tight. Do you think that'll help health systems keep up?
Hopefully, yes. More vaccine options give countries more flexibility, especially if they struggle with cold chain storage or have limited staff. But there's an issue with the 4-dose schedule. While 96% of kids get the first dose, only 39% finish all 4. That's a real challenge.
So it's not just the science, it's logistics, funding, too. To reach the goal of vaccinating 52 million children by 2030, steady funding is going to be key, especially from donors like the UK. Gavi, the Vaccine Alliance, is central to all of this.
Countries need to invest in a lot: training health workers, keeping cold storage running, reaching out to communities. It's all about making sure parents bring their kids back for every dose. If they don't, the whole impact drops off.
And vaccines aren't the only defense here. Insecticide-treated nets, indoor spraying, rapid diagnostics, they're all still crucial. The pilot data showed that combining bed nets and vaccines meant over 90% of children got at least some protection.
That's the big picture. It's not about just one intervention, it's about layering them, building a safety net for kids who'd otherwise be at risk.
So, as we hit this turning point, what does this mean for malaria's future in Africa? Is this finally the start of the end for a disease that's haunted so many communities?
It's a hopeful step for sure, but the job isn't finished. This shows what global teamwork, scientific progress, and dedication to public health can actually do.
Thanks for being with us. Today, we looked at how malaria vaccines are saving lives, the science behind them, and what challenges still lie ahead. The fight goes on, but millions of children now have a better shot at life.
Stay curious, keep learning, and thanks for listening.